Everyone, welcome back to the FU Cancer podcast. Today, we're talking about the fear of recurrence in cancer care. A cancer diagnosis doesn't just impact the body, it profoundly affects the mind, emotions, and relationships that we live and breathe every day. One of the most common and most often underestimated challenges that survivors face is the fear of recurrence, this persistent worry that the cancer might come back. This fear can shape how we make decisions, it can strain our relationships, and overall, it can affect our quality of life long after the cancer treatment concludes. So, joining me today to unpack this important topic is Adrian Pogashin, a licensed clinical psychologist with advanced training in psycho-oncology. He holds a degree in global health diplomacy from the Geneva Graduate Institute and a certificate of medical intel from Mayo School in Oberammergau. He is the founder of the INCKA Psycho-Oncology Center and serves as host of Beyond the Cancer Diagnosis, an interview series found at oncodaily.com. Adrian is also a journalist at cancerworld.net, co-author of the first Romanian multimodal care guideline in pediatric oncohepatology, and is an active contributor to the International Psycho-Oncology Society, also known as IPOS. He currently serves on the IPOS Fear of Cancer Recurrence, or Forwards, Special Interest Group Board, and is a founding member of the Early Career Professionals in Psycho-Oncology Committee. With expertise in coping with cancer, communication in cancer care, and post-traumatic growth, Adrian brings a truly global and deeply human perspective to this conversation. Thanks for listening to the FU Cancer podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. Well, Adrian, welcome to the FU Cancer podcast. We really appreciate you spending your time with us today. Was hoping we could start by having you explain what is psycho-oncology and why is it such a critical component of comprehensive cancer care?
Hi, Christina. Hello, everyone. Thank you for having me today. To answer to your question, officially, it's let's say the psychosocial dimension of what cancer brings into our community. But from the ground, it is the side effects, including emotionals and the feelings that everyone diagnosed with cancer goes through. So it is the more or less the emotional component of the cancer diagnosis, because each cancer patient receives two diagnoses. One is medical, the other one is psychological. So psycho-oncology treats the psychological dimension of cancer, and we are as a community focusing on managing the emotions that are within the patients and within its family and community and so on.
So, fear of cancer recurrence is something that we hear about. And I think as cancer survivors and loved ones of cancer survivors, it's something that we deal with daily. So my husband is a cancer survivor. He had testicular cancer over 25 years ago. And it's a very unique perspective, I think, that whenever you have a severe headache or leg pain or something, right? Something that other people would just think is a headache's a headache. But when you have a cancer diagnosis, a headache could be metastases, right? It could be something very serious. So that underlying fear is always with you. I think in the core of your being, it's always in the back of your mind. So how do we kind of define or put a label on that fear? And then Why is it so prevalent among survivors, but something we don't really talk about much?
Um, I will start with, let's say, to the end of what I wanted to say about fear. Fear is an emotion. Fear is something that comes natural, but hope it's what we choose. Hope it's something we learn. So this is the end of the process, to put it this way. Now, uh, to arrive at the beginning of the process. Fear of cancer recurrence, it's from our profession point of view, something very new. It was started as a field of interest back in 2017. And the official definition of fear of cancer recurrence is that means that it's fear, worry, or concern about the probability, but not the possibility, that cancer will return or progress on the same place or on other part of our body. And here are some words that I want to underline. It's a concern and a worry about something that it will be or not in the future on the same place or in other part of our body. But there are no medical evidence that it will come back, but we believe that for sure, as you mentioned, a headache or something else means that the cancer return. So this is the official definition. And we are trying in our field of expertise to help patients express this fear, because fear, even though it is a negative emotion, it is part of our uh, emotional, let's say, system. It's part of our feelings. Uh, to be afraid or to have fear is something very normal. It is important how much can I manage this fear, or how much I can help by the instruments that I have, helping the patient reducing the fear of recurrence. This fear of recurrence is something that unfortunately will follow the cancer patient all the life. In some moments more, let's say, harder, in other moments softer, but it's something constantly that will follow the cancer patient. And we are trying to diminish, I guess it's the word, the worries and concern that each cancer patient have by a set of, let's say, instruments or routine, which is very important. And for those patients who want or accept hard conversation, we are going more deeply in talking about fear. Why is this fear? Yes, and to see where it comes from, where it goes, where it ends. So more or less, this is the fear of recurrence talking about. I
Well, and
hope I was quite clear.
from your clinical experience, what are
Yeah.
some of the most common triggers that will ignite or reignite this fear even after their treatment is ended?
On my opinion, there is only one that all the patient are talking about. It's uncertainty.
Mhm.
And we are discussing nowadays about chronic uncertainty. We don't know what the next moment will bring us. So it is an uncertainty. We don't know what will happen next.
Mhm.
As we all know, the cancer patients uh, don't have time. Yes, they have this feeling of not having enough time.
Mhm.
Yes, to complete the activities, to complete what they wanted to do. And this uncertainty just come and put a pressure on a fear that already exists, because the cancer patients live in the present. They are not living in the past. They are not living in the future. They are living in the present. So having already a fear, this uncertainty comes and put a pressure on this fear. And this uncertainty um, gives worries um, higher importance than it should be. So it's a certainty, worry, and it's fear. So the uncertainty, it's the main trigger of this fear of cancer recurrence, because we don't know what will happen next. We don't know if the treatment will go okay. We don't know what it will be. I don't know. We don't know. So this is an uncertainty. And we are beginning to develop some coping strategies dealing with uncertainty, because as specialists, especially from a clinical perspective, we didn't not believe, we didn't have evidence that uncertainty has such a big impact on not only on fear of the recurrence, but on all the cancer trajectory. More and more patients are talking about uncertainty as the main factor of, not fear of everything, that it's, let's say, bad in this process.
So I think it's, and maybe I'm overstating, but it feels like it's a fine line between kind of that fear and uncertainty versus something that's different in my body that could be a sign of recurrence. So where do people draw the line of I need to control my thoughts and emotion versus I need to call my doctor because there could be something going on? How do we differentiate the two?
Um, from my experience, I noticed that we should, as professional, and patients should themselves understand the side effects of having a cancer disease or a cancer diagnosis. After the treatment is over, there are side effects, and the main side effects are pain and fatigue. It's cancer-related fatigue, cancer-related pain. So working, counseling patients that pain, which I wanted to accentuate the fact that in that period, after the treatment is over, the pain is perceptive, not sensorial. Yes, we have a perception of a pain somewhere in our body, and the fatigue, which means the lack of energy of doing things. So counseling on these two major pillars will help us make the distinctions on what you mentioned, to understand what is normal, yes, pain and fatigue, and to understand where comes the uncertainty. But every cancer survivor has this uh, idea and this desire to come back to his or her previous life. This is a thing that can't be done because the reality is other. It's another reality, it's another dimension, it's another with almost everything. So they have to understand that a routine, a daily routine, once a day issue or once a day thing that I'm doing will decrease this fear of recurrence, and will understand that some pains are normal, being fatigued is normal, having bad days it's normal, saying no is normal, because the fear of recurrence mostly appear in this let's say way of not saying no. We are used to say yes to help the others, but there are moments where we have to say no, and the cancer patients have to learn to say no, often than before. And I guess here is this thin line. And there is another one which is called the problem solving, where is a solution that is not fear of recurrence. Where we don't see the solution, there might there is the uncertainty, because I'm thinking, what if? What if it's happening that way? And where is no clear answer, it's fear of recurrence. Where we have an answer which is based on medical evidence, that can be managed in time. It depends on every cancer patient.
Where do you see situations where the fear of uncertainty extends to family members? And then how do you encourage those individuals to kind of cope with it?
This is a very interesting situation about the family members, because, as I mentioned at the beginning of our interview, cancer is not a disease that you can handle alone.
Mhm.
And it's let's say it's like a transitions of fear, sometimes from the patients to the family, but mostly from the family to the patient. And I don't know, for example, on the US, but in Romania, I am dealing mostly with the fear of recurrence for the caregivers, not from the cancer patient, because the cancer patient, it's very, let's say, attentive, and he follows the advices. We have an issue, or we have to deal with the caregivers. And the first things that we have to deal with is, of course, fear of recurrence. What it will happen if, again, our family member will have cancer. And I guess, talking about family members or caregivers, it is not like on the situation of the cancer patient, but it's another situation. About cancer patients, we are talking about feelings and emotions. But if we are talking about caregivers and fear of recurrence, we have to introduce this component of financial toxicity, because the battle for treatment from, let's say, logistic or administrative point of view, it's done by the caregivers. Yes, the cancer patient has the battle with the disease. The caregivers have the battle with, let's say, the public health system. Mm-hmm. And it is an important component that we have to take into account when we are talking about fear of recurrence, about caregivers, this financial toxicity. Mm-hmm. Because it is a fear that it might happen again, we will not have the necessary financial to go to another cancer experience. Mm-hmm. And this is often an often issue that we are dealing with in Romania, for example. And I guess this is the main component or topic about caregivers and their fear of recurrence, other than to be next to the cancer patient.
So how do you help your patients move forward? What if they are, sort of stuck in that fear, or that I'm living in the today and I want to move forward, but I just can't? How do you help them move forward?
Here it's it's an interesting questions, by the way. Everyone gets stuck to a moment. Even us professionals, sometimes we are stuck in thoughts. We are stuck in what we want to work with our patients. But returning to the cancer patients and their cancer care trajectory, of course, there are moments that the lack of motivation appear, and we are talking about motivations, and we are talking about not the lack of hope, but sometimes too much hope means a false hope. This is one of the, let's say, tricky things. There are two that I want to mention here, and we are working, or at least I'm working a lot on these issues. First is that too much hope is a false hope. And this is one of the issues that give the cancer patients an unrealistic image of the of the disease and his way of dealing with the cancer, because he believes just in hope and in not doing something else. And when you put so much hope in something that it will not be consumed or finished, we will not have the motivation to go further. So the hope, we are trying to manage it very, very, let's say, safety. And the other one is this tyranny of positivity. Everyone comes said that I should be more positive. I should be. For cancer patients, this thing of should, must, the imperatives should be avoided. They don't have to must or to should. If you weren't a positive person before, you can't be a positive person now, or you can't be more positive than you used to be. So again, this thing of positivity we have to diminish to the level of the patient. Then it is what is called the meaning of life. And here is the issue and the point where many cancer patients got stuck, the meaning of life. They are very introspective and retrospective. They are thinking a lot on the past. They are thinking what if, or except the why me questions, they are thinking what if. And there are moments when it seems that this battle with cancer will not go anywhere. There are moments when they feel that what I'm doing is for nothing. And here is the component of meaning of life. What legacy do I have, or what legacy I want from now to let to the ones that I love? And trying to find the meaning of life, trying to find what legacy, what sources of meaning of life do I have. It is a good instrument to unblock these feelings, because we are not talking about giving up on a treatment. We are just talking about the feeling and the emotions that this battle will not go anywhere, or I will not win this battle. And here comes the idea of what I really want to leave behind. And I guess this is the issue or the topic that can make the click to move forward.
Talk to us a little bit about post-traumatic growth. And in the context of cancer survivorship, how can this fear really become a catalyst for growth and moving forward?
Post-traumatic growth, it is an interesting field of expertise for me. It is an interesting domain introduced by Professor Tedeschi and Calhoun. Apparently, they have nothing in common with cancer. And this is what I love, the idea of post-traumatic growth, working with cancer patients. Why? Because out of the 5 domains of post-traumatic growth, there are 3 at least common with each cancer patient story. And these are new possibilities, personal strength, and the appreciation of life. For some cancer patient, the cancer experience might seems like a traumatic event for some cancer patients, not for all. And if it is seen like a traumatic event, we can apply these instruments developed by the specialists that I mentioned before to help the cancer patients or the cancer survivor better understand or better help them in moving forward, as we discussed earlier. And this personal strength and new possibilities, it's related with the new meaning of life. Yes, because after a trauma and post-traumatic growth means that there is we can find the good in bad, or every traumatic event or challenge in our life could lead to something good if we find this opportunity. So if we find an opportunity in every challenge, then we can overcome our traumatic experience. And talking about cancer patients, this appreciation of life that maybe you saw it yourself during your experience. Yes, you saw the life different. You appreciate the small or the little things more deeply. Yes, it's another view. Uh, a win battle gives you a personal strength, and these new possibilities that I've never seen before, even though they were around me, gives, let's say, a feeling of wow for cancer survivors, a feeling more than motivation. It's like a new vibe within themselves because they found, let's say, the oyster, after all this mud. And there are cancer survivors that they are happy in a way that this experience made them be different, made them be better than before. Of course, it depends on every cancer story, individual, but for some of the patients I mentioned before, which treat cancer as a traumatic event, there is this opportunity and there are the instruments on working on this post-traumatic growth. We can grow out of a cancer experience for sure. Cancer is not that as we were used to learn before.
In your experience, have you identified any cultural or systemic factors such as access to psycho-oncology services that influence how people cope with these fears kind of on a global scale?
There is, when we are talking about fear of cancer recurrence, I want to mention the fear of recurrence therapy developed by Dr. Sophie Lebel and Christine Mathieu, and they are from Canada. And I was trying to translate and adapt this therapy for Romanian population. And I know it is translated in Spanish and in Turkish. There are a lot of cultural differences within us. So, for example, in Romania, due to cultural backgrounds and cultural barriers, some of the things from that therapy couldn't be applied. Because if we are talking about cancer, more or less, we arrive to a discussion about that. And the discussion or the idea of that is the main point where began the cultural differences. We see that in our cultural background totally different from country to country, from region to region, from continent to continent. So there are a lot of cultural differences, but hopefully not barriers, only let's say differences that might or not be let's say completed, and it is an important factor. And I know, and I give again the example of Romania, that not too long ago cancer equal death. So this was like a principle that was for years in Romania. Then it was the thing that if I touch somebody, I will get cancer. So it was another misconception. So we are talking about cultural differences. We are talking about misconceptions. And what we are trying to do in psychoncology and with the aid of all the organizations like IPOS or MASK, it's to underline the fact that cancer is the same for everyone, and we have to avoid, or at least to get rid of these misconceptions that appear in different parts of the world and which interfere with our counseling program or even with medical treatment. So here is the problem: when due to the cultural background we can't move forward. Because you asked me about how the cancer patients can be unblocked, and I told you about our perspective as a specialist, but if we are talking about cultural backgrounds, we don't have what to do, and this is a problem about this.
Adrian, we just have a couple of minutes left in this recording. So what advice would you offer someone who's listening today, who is silently struggling with this fear of recurrence, but isn't quite sure where to go start to get help?
The most important thing is that he or she have to find the strength that I mentioned before to talk with someone. As I told before, cancer is not a disease that we can handle alone. It is not a disease that we can go through alone. And the need for psychosocial support is extremely important. Psychosocial support means friends, family members, people like me, doctors, medical team, everyone, social worker. And communication is essential. So you have to find, let's say, the power to express the feelings, because they are not bad feelings or good feelings. There is no bad or good, because you never go through this before to know if it's bad or good. You just experience now things, so you can't say it's good or bad. So just find someone, talk with, and you'll see that talking, you'll get rid of this pressure, because the tendency is to be isolated. The tendency is to fight alone, and to be very close within ourselves. And this is our struggle with cancer patients, to open them, to open their emotions, to see their feelings, to make them feel appreciated for what they are, to be appreciated for what they might become, to make them believe that they can arrive at that point. And as I always say, we have, as psychoncologists, two missions. One is to build hope, and the other one is to give time, to give the perceptions of time. There is time. For every cancer patient, there is time.
Well, Adrian, thank you so much for sharing your insights and expertise with us on such an important but often unrecognized thing in cancer care. So understanding and addressing the fear is not just about mental health, it's about quality of life, strengthening relationships, and really empowering survivors to truly live beyond their diagnosis. So thank you for being here with us today.
Thank you so much, Christina, and hopefully I was clear enough to everyone who will listen further. Thank you again.
Yep. And listeners, to learn more about Adrian's work, you can visit incka.org, or you can, of course, follow him on Beyond the Cancer Diagnosis at oncodaily.com. We'll put that link in the show notes today as well. And for our listeners, thank you again so much for being with us on this journey. Until next time, I'm Christina Rollins. Thanks for listening.